Hi everybody, this is Sharon Parlia, your instructor for the Fundamentals of Health Informatics course T2060. Today we're going to talk about Module 6, which has to do with the Pyxis machines. We're going to talk about everything Pyxis and MedStation. Hope you enjoy the course. So what is a Pyxis machine? We hear this term in the hospitals. We often see them even, walking around, nurses walking around with them, but what are they and how do they work and what's their purpose? So basically, a Pyxis or a MedStation is an automated unit used for the distribution and storage of medicine in clinical areas. It also has functionality. It interfaces with patient management systems, like a registration system, and the pharmacy dispensing system. So it knows who the patients are and what the drugs are that are in it. And it's beginning to also interface with electronic prescribing systems as well. The Pyxis machine also has the functionality of providing risk management. It does this by promoting pharmacist intervention in detecting prescription errors. It also minimizes dispensing errors from a clinician's viewpoint. Also, it minimizes administration errors due to the wrong choice of medicine and provides point-of-care warning and alerts to clinicians. You don't want to double medicate a patient or give the wrong patient a medication. So it does do checks in that manner as well. Let's talk about the days before these Pyxis machines existed. Medication carts were used for storing medications dispensed by the pharmacy for individual patients. They were also used for stockpiling of items. This led to major frustration. It was very difficult to find medications. Everyone clinicians were, for use of a better word, almost hiding them up on the unit so they didn't have to go down to the pharmacy to get them, or they were holding them for after-hour purposes when the pharmacy wasn't open. Now let's talk about security on these med stations. We'll talk about how it works in a moment, but right now I just want to discuss the fact that a major purpose in using the Pyxis stations is their level of security. You can't just open a drawer. The drugs aren't just there. You need to uniquely identify who you are as a clinician, as a nurse, before you can even open the drawer or have access to anything within the Pyxis station. So basically, all users need a unique logon and password. Sometimes they're using finger scans, but you need to uniquely identify yourself to get into the med station. So how does a Pyxis machine work? Let's talk about that for a moment. First off, the prescriptions that are ordered by a physician are reviewed by a clinical pharmacist before being entered into the Pyxis system. So the flow is a doctor would order a prescription. The prescription is then received by the pharmacy either through an interface, or it's called down, or it's sent down and they receive it, and then the pharmacist will review the prescription and enter it into the Pyxis machine, either manually or through an interface. Next, the nurses are presented with a list of the patient medications that have been validated by a clinical pharmacist. So the pharmacist validates it, then it's up to the nurse to look at the list of patient medications, which she is doing today, but now it's done on the machine. Continuing on, lastly, as everyone has validated everything and the nurse has entered her information into the machine, the drawer opens and the nurse is asked to remove the required amount of medication. Below you see a picture of a sampling of what an actual Pyxis machine does look like. So, as with most things, Pyxis comes in all, not all, but many sizes and shapes. also, specifically, they come with different types of drawers. Below is a sample of the matrix type drawer, with different compartments in a drawer. So this is good for storing large, bulky items. They also have smaller drawers for, storing smaller items, pills versus vials, versus insulin bottles. Now let's discuss some of the benefits to the patient with regard to the Pyxis machines. First off, it provides safer medication management. It's safer, it's secure. It also increases the range of medications that are available on the unit. They're there. And because of this, this leads to another benefit, which is the time to first dose. For the patient, this is very important. When the time is decreased from the ordering to the actual receiving of the first dose of a medication, this will help the patient in the long run. They don't have to wait for the pharmacy to fill the prescription to be sent back up. All these things take time, so this is clearly an improvement. Now let's talk about some of the benefits that are seen by the nursing department. First one being security. As I said, all meds are locked and secured. They're not just hanging around the nursing unit. Next, single point of access. Less time nurses need to spend searching for medications on the unit. They know where they are. They're in the Pyxis machine. Next, it's a decrease in access and also need for an after-hours medication closet. What this means is often when there's a pharmacy within a hospital in the evening hours, they're not open, and they keep just a closet open that a supervisor has a key to. So there's a lot of running around looking for medications after hours. This is originally why many places, hospitals, especially emergency rooms, started getting Pyxis machines because of this after-hour access that they require. And also, controlled drugs are recorded electronically. In fact, all drugs are recorded, so there's a good audit trail on what was given to any patient, when it was given, and where it was given, and by whom. Lastly, we're going to talk about the pharmacy benefits of having a Pyxis machine. First, they are secure and a safe storage of medications. It's a safety issue again. Also, inventory requirements are transmitted electronically to the pharmacy, improving workflow. It does improve workflow. It reduces turnaround time from the moment the order is placed until the patient actually receives the medication. Also improves communication with nursing. Any type of communication within a hospital, when it's improved, is always a good thing. Also controls and manages inventory. When you have a tracking system, when there's audits that can be done, you can also run reports. Reports are generated showing the, items that require refilling. It reduces workflow. It increases functionality. It increases patient satisfaction as well. It also allows the pharmacy department to know what their stock levels are of all medications on the units. Good inventory control, tracking control. Very important, especially in a hospital. Well, I hope you all learned a little something about a Pyxis machine, whether you knew about it before or not. They are interesting and definitely a benefit to the hospital workflow. I hope you enjoyed this module, and I look forward to seeing you all on the next module. Thank you.